What does the ability to scan and track a brain, an Alzheimer's brain, mean for research? Does it mean anything?
So we have the potential, we've got lots of potential therapies. And there are two ways this imaging, I think, can make a big difference. First of all, we can make trials more efficient, faster, so that we can test more treatments. The other thing we do is we've opened up a window of opportunity that was never there before. It may well be that the most effective way of slowing this devastating disease is intervening before too much damage is done. And imaging gives us that window. In fact, it may be the only way we intervene effectively.
Right now, or like in the near term? Okay, and just one last thing. Can you, you showed some great slides of your research. Can you just give me a brief description of what we were looking at when, in terms of your research, and what you found through this imaging, tracking some people as long as 20 years?
So what we know from many groups around the world, converging evidence that proteins build up in the brain that are toxic, perhaps 15, 20 years before people get symptoms. And then after that, but still before symptoms, we can see vulnerable areas of the brain starting to shrink.
Do you think in the future, I know not right now, that a scan may be a normal procedure accessible to everyone?
Absolutely. Absolutely. I think in the same way that what we do was revolutionized in cancer, once we have effective therapies, it may well be that we have very simple, could be blood-based, it could be imaging-based, biomarkers and diagnostic tests that will be assessing people once we have effective therapies. So that's what we've got to do.
Right, so it's not worth it now before you have the therapy.
No, people need to do the sensible things, live their life to the full, but not have their life ruined by anxiety about something for the future.